Hi, this is Clarissa from Guada Psych Services located in Schaumburg, Illinois, and today we're going to be talking about what to expect from your very first therapy session. I often hear in practice that people are really nervous in anticipation to their very first therapy session, which is totally natural. The therapy relationship is a very unique relationship that you do not come across. It is a different relationship that will bring up different feelings, relationship that we will be working towards and will be navigating together. It will take some time to build that relationship. As with any relationship, it takes time and trust. Outside of the feelings of nervousness, I'm also really curious to know what their first therapy session will look like, whether you've been to therapy before in the past or this is your first time in therapy. Each therapist approaches their sessions differently. As a part of the first session, we will conduct what we call an initial mental health assessment. We will also be looking for occupational functioning, academic functioning, marital functioning, social functioning, the history of the problem, the presenting problem. We will also ask about any current outpatient mental health treatment, any previous treatment, any current medications, any previous medications, substance use treatments, and we will look at family history as well. All of these areas are very important when looking at the presenting stressor, issue, conflict that an individual will be seeking therapy services for. All of this information we use to help you navigate the current stressor, the current issue, and in a way that is suited for you. Aside of the mental health assessment, we also go over housekeeping things, as I like to call it, which include the practices policies like cancellation fees. We also discuss HIPAA and your right to confidentiality and what that entails. The last thing that I will touch on during that initial meeting will be scheduling, but it will be dependent on the individual and something that we will talk about during that first meeting. And I will also provide my phone number for scheduling purposes. If my patients ever need to speak to somebody outside of their session time, I always encourage them to call 911 if it's an emergency, or call or text the number 988, which is a 24/7 crisis hotline. It's a free crisis hotline, and it connects you to a mental health professional that is available to talk with you on any mental health related concern. I always encourage my patients to use the hotline just because I'm not accessible 24/7, and I want to make sure that they are provided with the right resources. And that wraps up what to expect from your very first therapy session here at Guada Psych.